Hi and welcome to another video from the CTAD Clinic. I'm Dr. Mike Lloyd, the Clinic Director. In the video today I'm going to be looking at a case example of a way that a symptom can present within Dissociative Identity Disorder, also known as DID. And there's a really key criteria for being able to recognise and understand when DID is present, and that's this thing about possessions. That a lot of the times people with DID can either find things in their possession or find things missing from their possession with no real explanation as to why. And sometimes the things that are found make no sense. And sometimes the things that are missing aren't just stuff that's been sort of mislaid. So, for example, I might come in after a long journey and put my keys in a place I don't normally put them for the car, and then I can't find them a couple of days later. That's just being mislaid. This is where you know that you've put something down in a very specific place, and when you come back to it, it's simply not there. So the case example I'm going to give is from a young woman who I worked with who was later diagnosed with DID, but had initially been diagnosed with schizophrenia and had been prescribed a number of different medications for that, also known as antipsychotics. And what was happening when I started working with this young woman, she was getting particularly distressed in therapy. This has all been okay for me to talk about, by the way. And she was particularly distressed in therapy because the medications would go missing. And she knew that they hadn't just been mislaid or just put in the wrong place, because there was a specific place for all the medications to be located. And when she went back to them in order to take the medications on any given day, the pills were simply not there. And for obvious reasons, that was really bad for her, because she wanted to take the medications as prescribed because they were having some sort of effect on her. And the diagnosis of schizophrenia was a bit, whether or not that was correct or not was up for grabs. But she'd become reliant on the medication. They had a soothing effect. They helped her calm down, and they worked really well for her levels of anxiety. But what was happening is that the pills, the actual sort of the box that the pills were in, just went missing. It went absent. She would turn the house upside down, wasn't able to find it, would get in incredible distress, have to go back to the GP, try and get re-prescriptions and all this kind of thing. And sometimes these pills would turn up from time to time, but it just didn't make any sense to her at all. Now, when we were working with her, the diagnosis of DID was very, very clear. There was no real sort of, disagreement about that. She accepted the diagnosis. We understood that there were many different parts within the system and that these parts can have variable different effects. And as we got through therapy, this is one of the things that cropped up. She would be distressed. We talk about what's going on. She said, "I've lost my pills again. I'm such an idiot. I'm stupid," etc., etc. Very much about blaming herself, taking responsibility for it, and feeling a lot of shame and a lot of guilt for having to take up the GP's time and the pharmacist's time and all of these sort of things to get these re-prescriptions. So we started looking at this, and we realised there was a pattern that was taking place. And the obvious explanation was that whether or not a part within the system was relocating the pills from this person so that she couldn't take them. That was our formulation, and that was the thing that we believed that might actually be taking place. Is that during any given day there'd be a particular point where this young woman would dissociate, another part would come through, they would go to the pills box, they would take that, they would move it, hide it, throw it away, whatever they were doing, but take it away from the lady so that she wasn't actually able to take the medication. Now, she couldn't really understand why they would do that, because the pills were designed to help her, and that meant that some part of the system was actually acting in a sort of counterproductive way, doing something which potentially could cause her a lot of grief and some harm if she didn't take the medication that she was prescribed. But we stuck with our formulation, and we stuck with the point that for some reason this part did not want her to take the pills and therefore were hiding them. And the strategy there was that it helped to really understand that this is how powerful the dissociation could be, that the switches weren't just related to trigger events, they weren't related to distressing things that were going on outside in the world. This was something that was happening at home that she had no memory of, so there was clear amnesia for the switch. She wasn't conscious of what was taking place, and she had no memory for where the pills were. She knew that if they'd been located in a place that was sort of within her understanding, with her conscious awareness, she would just automatically know where the box was, and that wasn't the case. She couldn't find them. No matter what she tried, she had no idea where they were, and she couldn't find them at all. So our formulation came down to there is a part which does not want her to take the pills, and therefore prior to her having her normal time of the day where she would take the pills, the part would dissociate the lady out, would switch, would front, would take over the body, go to the box, relocate, throw it away, doing whatever it was going to do. And we had to try and figure out why that might be the case. We asked, we got some responses which sort of intimated that the pills had a sort of a sedative effect, which is kind of what they were designed to do, reduce her anxiety levels, but actually they sort of brought the system down. What was happening is that parts within the system felt that they were being drugged. That every time she took the pills, it felt like they were having a sort of sedative effect on the system, and the parts were feeling woozy, feeling a bit, sleepy. They didn't like that. That had bad memories and bad sort of associations for them. So they felt, in a very, very simplistic way, if we stop her taking the pills, we don't have to deal with any of these things. The issues of non-compliance, they didn't really care about that. The issues of potential side effects for not taking a medication that she'd been on for a long time, they didn't really care about that. So the context of why the pills existed in the first place, they didn't really care about, or they weren't interested in. It simply wasn't relevant. What they cared about was they didn't want to feel drugged and woozy and sleepy, so they just stopped her taking the pills. The solution then became really simple. It was about helping the lady communicate with the parts to find out where they were putting them, first and foremost. We managed to find some hiding places within the house that she had no idea that they were there, but they seemed pretty obvious actually. And then it was about helping the parts understand that it wasn't a good idea for them to do that, but to open these levels of communication about what being woozy felt, which had some trauma associations, which were very difficult conversations indeed for that person, for that lady to go through. And the parts kind of started helping her work that out as they went along. The most important part of it all was that she gained an understanding of where the pills were. So as soon as she realized that the pills were absent, instead of turning the house upside down and looking for them all over the place, she was able to communicate internally to the part or parts that were taking the pills and relocating them to ask where they were. And it was done without anybody being in trouble. So we had to frame it in a way that meant that it wasn't about accusing any part of stealing them. It was about being really thoughtful and patient and saying, I guess they've been moved again, but I do need them. If somebody could help me work out where they are, that would be really cool. None of the parts got into trouble for relocating. And when she opened these lines of communication up, she was able to help them understand how important the pills were. Ultimately, it led to reductions in dose because she realized that actually that sleepy, woozy effect that the pills were having wasn't really doing her any good. And there was sort of a movement away from the antipsychotics as her confidence grew anyway. So we got into this sort of nice middle ground really with the medication and the prescriber to sort of deal with all those issues. And what it allowed her to do was communicate directly with the parts, understand where they were coming from, is that their needs and the things that upset them or the things that they needed to do were slightly different to her own, and that had a really positive effect overall within her sort of therapeutic progress. So DID can really set people up for this. This lady learned a lot about her parts. She learned a lot about the power and the influence that the parts could have, how they could take over, not always in response to a traumatic trigger in the environment, but to do something that they felt was slightly different from the trajectory that she was on, and that you had to sort of balance out all the different needs and intentions of all parts within her system in order to really sort of build a more healthy approach to everyday life. She solved that issue, we figured that out in therapy, and it changed a lot of other things for her. But it struck me as being a really good example of just seeing quite how powerful DID can be and how logical it can be, because when you looked at it from the perspective of the parts, it made a lot of sense that they would do something like that, relocate, hide, or throw away these pills. And only by understanding that we were able to work with them to try and reduce that behaviour, because ultimately it wasn't particularly helpful behaviour for the whole, and that was what was most important. So I hope this has been a helpful video. It's a case example looking at something that DID can do that is kind of like a little bit strange in some ways, but when we get into the formulation of that, it makes complete sense. So I'd be really interested to hear the comments and hear your thoughts about this, and maybe some experiences of losing things for yourselves, because I think it goes a lot further than just, say, medication. There's many things that can go missing, and we'll keep producing videos for the channel, so do all the like, subscribing, notifications to be aware of those, and in between now and the next video, please do take great care.